Everybody needs to calm down. She gets anxiety, and I'm calming everybody down, and she's crying.
Jose Perez remembers feeling helpless.
My voice wasn't being heard.
The day in November of last year burned into his memory when the love of his life, Christine Fields, went into labor.
Nobody was listening to me.
Fields was rushed to Woodhull Hospital in Brooklyn. Just minutes after her arrival, she experienced complications following an emergency C-section. Perez says it was the worst day of his life.
I basically find Christine lifeless.
What happened next, Perez says, only added to his pain. An intense feeling of being disrespected by the very same doctors he entrusted with his wife's care.
Christine's moms ended up falling out on the floor, catching an attack. They didn't even attend her. They just got on the elevator and left. And it was just like, she's no longer here. Christine never made it home.
After 11 dark days, Perez says he was finally allowed to take his newborn baby home. His story, just one of many heartbreaking scenarios of mothers losing their lives.
Look over there.
Little Chloe Lopez, a typical 4-year-old full of energy, also lost her mother, Shayasia Simple, the same day Chloe was born at Woodhull.
She went in for an epidural, and he didn't see her after that. Next time he saw her, they was pumping on her chest, trying to, to revive her. He found out that she passed away.
Chloe's grandmother, Desiree Williams, also describing feeling disrespected by staff at Woodhull. No explanation given as to what happened.
Stuff like that happens sometimes. That's what they said.
Sadly, there are others, part of a disturbing pattern at the hospital. In September, 24-year-old Beverlyn Garcia Barrios also died while giving birth.
I feel sad that these things happen. Honestly, I really feel sad that women have to go through this in this day and age. Christine should have not went through it.
Family recollections backed up by hard numbers. According to the New York City Department of Health, an average of 20 women die each year from pregnancy or childbirth-related causes. Black and brown women make up a majority of the fatalities. Black women are 9 times more likely to die due to pregnancy-related complications. Experts agree systemic racism often drives the disparities.
This is not just a New York City phenomenon. This is evident also in New York State, not to the same level, and across the United States. We're seeing it across the board that Black women have that increased risk and rate, no matter which hospitals.
Dr. Christina Pardo, an OBGYN, spent years in hospitals, but stepped away to do advocacy work, especially to help women in her own community.
Haitian and Black immigrant families in which they face those same risk related to maternal mortality and death related to pregnancy, but there wasn't the same level of awareness, and they had really a lot of difficulty in navigating the system.
We're just gonna have everything here.
Alana Wade is a doula and yoga instructor. She has been working with pregnant women for years, supporting them during one of the most vulnerable periods of their lives. She opened Full Circle Wellness in Harlem to make sure women of color have options.
A lot of people that are Medicaid recipients, they don't have the best access and spaces when it comes to providers, like aesthetically, professionally, just the lack of holistic care, which can be very crucial during pregnancy.
Wade offers a wide range of affordable services to help expecting mothers every step of the way, including after the baby is born.
It's like a full circle of nutrition, emotional support, therapy, wellness consultations, yoga, moving your body, sound healing.
I thought I was going to spend the rest of my life with her. And on November 13th, that changed.
I got one more toy inside.
Perez is now raising the couple's baby boy, Anuel, and their 2 other children alone, while trying to navigate his next moves. Perez tells Pix 11 News this tragedy has thrusted him onto the front lines of a movement.
Shame on you, Woodhull. Shame on you, Woodhull.
They're demanding better laws to protect women and their families.
I've been turning my grief into, and pain into a voice. It's hard, it's not easy to do, but I've definitely been out there. I've definitely been rallying for the grievous families.
What would justice look like for you?
Laws, not policies, laws. The Grievance Families Act hasn't been updated since 1840 something.
I love you so much too. Of course, you can give me hugs whenever you want to give me hugs. I love you too.
How are you going to keep his mom's memory alive with him?
I show him a lot of videos and I constantly talk to him about his mom. The hardest thing was I wasn't prepared for was for him to start calling her. So the other day he just started calling her name, Mom, Mommy, 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 and I'm like, who you calling Mommy? And he really like just screamed at me, Mommy, Mama, Mama, and I'm like, whoa, I'm like, it really broke my heart because it was really sad.
I love you. You love me? You love me? You love Daddy?
New York Health and Hospitals says HIPAA prevents it from speaking about any specific patient case. But in a statement, the healthcare system says that it, quote, provides quality, culturally responsive healthcare services to address the disparities and race-based healthcare gaps that historically and disproportionately affect the diverse population of patients we proudly serve, end quote. Nicole Johnson, Pix 11 News.